And you said he should have, if he doesn't have the backboard, then he should have dropped him on the floor.
Yes.
Should he taken the IV line out first, or should he just...
Well, he should have stopped the propofol drip before doing anything. But yes, he should have been careful not to lose the IV line when he puts him down on the floor.
When you talk about this propofol drip, in the event there is a propofol drip, would you expect there to be an IV bag with propofol in it?
Objection, speculation, big.
Sustain.
If you were
352 territory.
If you were going to determine that there was a propofol drip, what would you expect to find at the scene?
Objection, speculation, 352.
Sustain.
Can you have a propofol drip without propofol in an IV line?
If the drip is gone, yeah.
Now, you've worked with propofol before.
Many years ago.
And it's very sticky and it coats the lines, doesn't it?
I usually see it. I can't answer that question. I don't give it in IV. I would give it in an infusion because I would give it for a very short period of time during a cardioversion. I've never given it during an infusion.
Have you ever seen it infused?
I've seen it infused. It looks white, but I've never seen an empty one.
And so you haven't had the experience of inspecting an IV line after it's been used for propofol?
No.
And you don't know one way or another whether propofol would still be in that IV line?
No.
You indicate that there should be suction?
Yes.
Wouldn't turning a patient on his side and clearing his mouth with your fingers be just as...
No.
Is your testimony everywhere propofol is used, there's suction?
Every time I give moderate sedation without propofol, I insist on suction.
But is everybody use those same procedures?
Absolutely. Everyone who gets conscious sedation gets suction. That's part of the standard of care.
But you've never used propofol for conscious sedation, have you?
I've never used propofol. For moderate sedation, I'm using Versed. I use suction.
If I could have just a minute, Your Honor.
Sure.
This, never seen propofol given without there being a defibrillator present?
Absolutely.
What are the drugs that he was supposed to have immediately accessible?
You should have amiodarone, lidocaine, atropine, epinephrine, dopamine, dextrose, methylprednisone. I think that was it.
And this is for conscious sedation.
We should have a crash cart, and that crash cart should have those medications, their equipment, those medications.
Do you know if Dr. Murray is certified for conscious sedation?
No.
Would it make a difference in your opinion as to his ability to use propofol if you knew that, one way or another?
No.
Now, the documentation. You document every patient you see with what you've done and approximately what time you did it, correct?
Yes, sir.
Have you ever had custody of a single patient that you spent 15 hours a day with?
No.
The documentation isn't that really for purposes of enabling you to remember what you did?
It's one of the reasons, yes.
And because you want to know how the patient responded to certain situations and certain medications and what you did with that patient.
Yes.
Would you agree that there's less difficulty remembering in the event you're only treating one patient?
Dr. Murray did not show that ability on this one patient on one night. So my answer is apparently not.
I didn't. Could you repeat that?
Yeah. The answer is that even though he had only one patient, he didn't recall a lot of the events that happened from that one night. So obviously he should have documented what would have happened. Things would have been clearer. So he absolutely should have documented.
His recollection, he had a recollection at 1:30, 2 o'clock, 3 o'clock, 5 o'clock, 7:30, 10:40 to 10:50. He repeated all those times, didn't he?
He did.
And he said what he did at those times, correct?
He estimated, yes.
Okay. Do you think that his not having written down what he recalled was a causative factor in Michael Jackson's death?
If he would have remembered exactly what he had given, he could have communicated that to the emergency room doctors correctly. And the answer is that it probably wouldn't have made a difference in the causation of his death, but it's still a deviation from the standard of care.
Okay, so the failure to document and give that information to the hospital personnel was not a cause of his death?
No, no. But can I clarify, when I review cases for the state of California, I state all the deviations from standard of care. Let's say I'm a cardiologist and a patient comes to my office with a heart attack and I miss it. I don't notice it. But my partner, on his way out, goes to my patient and goes, "Hey, you look kind of bad. Come on in." And he discovers that the guy has a heart attack and saves his life. The patient's fine. He didn't die. But I still deviated from the standard of care. I missed it. So even though he didn't document, like he didn't need the backup battery, it's still an extreme deviation from the standard of care.
But it's not a causative factor in the death of Michael Jackson.
I don't think it was a causative factor.
Mr. Flanagan, you let us know for purposes of the noon break.
This will be fine.
Thank you. Ladies and gentlemen, let's take the noon break at this time. Of course, please remember all of the admonishments, both the ones in writing as well as the verbal admonishments. Please enjoy lunch. The court itself is going to be recessed till 1:30 this afternoon. We'll see you all at 1:30. Dr. Steinberg, after the jurors leave, you may step down. Please don't discuss your testimony or the facts of the case with any other witnesses. Dr. Murray is present with counsel as previously indicated. The people by counsel as previously indicated. Dr. Steinberg, once again, is on the witness stand. All jurors and alternates are present as well. To everyone, good afternoon. To the jurors, good afternoon. Dr. Steinberg, good afternoon, sir. Do you acknowledge you are still under oath and still sworn to tell the truth?
Yes, sir.
Thank you. The resumption of cross-examination by the defense, Mr. Flanagan.
No further questions at this time, Your Honor.
Mr. Flanagan, thank you. Redirect examination by the people, Mr. Walgan.
Thank you, Your Honor.
Thank you.
Good afternoon, Doctor.
Good afternoon.
I just have a few follow-up questions. Mr. Flanagan had asked you if you knew whether or not Dr. Murray was ACLS certified, and you said you didn't know one way or another. Is that correct?
Yes, sir.
Did Dr. Murray act like someone that was ACLS certified in his care of Michael Jackson?
No.
Now, counsel also asked you about, or suggested maybe Dr. Murray was mistaken on the times. Maybe he was gone for as long as 10, 15, even 20 minutes. Doesn't that highlight the need for accurate medical records?
Absolutely.
Okay, to document the dosages, the time of the dosages, the vital signs, the condition of the patient at every important interval?
Yes.
Now, when you utilized propofol in New York, that was in a hospital setting?
Yes.
With all the monitoring equipment, things you've described here in court?
Yes, sir.
And when gastroenterologists and dentists and ER doctors get approval or through their societies, again, those approvals also dictate the need for all this monitoring equipment and that it be in the appropriate medical setting and things of that nature?
Yes, those societies dictate the appropriate training is necessary, appropriate monitoring equipment is also necessary,
All right.
and medical personnel to be accompanied to the doctor.
Okay. The sleep article that Mr. Flanagan brought up, you were familiar with that article before he brought it up to you?
Yes, sir.
And that did not say that propofol was an appropriate treatment for insomnia. It was simply an initial research article.
It was a research article that requires further study.
And in fact, in that was from 2010 out of China, correct?
2010, which is after 2009.
Thank you.
Thank you.
And it was first published in 2010.
Yes, sir.
And in that research article, patients were given propofol in a hospital setting.
Yes, in a hospital monitored setting. I think they specifically wrote down that the patients had the appropriate monitoring equipment.
And the study in China was approved by the Hospital Ethics Committee.
Yes, their IRB, their ethics committee had to approve it.
And what is an IRB?
It's a institutional review board. So anytime you do an experimental study, you can't just decide to do it. You have to get approval from an ethics committee, and they look over it and think if whether or not it's ethical and whether it's the right thing to do. And then once it's approved, then you can go ahead with the research trial.
And it was an experimental study.
This was an experimental study.
And they note that in their experimental study, they obtained written, informed consent from each of the subjects.
Yes, sir.
It was performed in a sleep disorders clinic run by a team of neurology and anesthesiologists.
Yes, sir.
They made certain that the subjects of the study fasted, in other words, did not eat prior to being administered propofol.
I think it was 8 hours.
8 hours of fasting.
Yes.
They were fully monitored, and specifically notes that they were placed in a room with blood pressure, electrocardiogram, and pulse oximeter, oxygen saturation, and each patient was constantly monitored during each treatment, correct?
Yes, sir.
The propofol was administered by use of an infusion pump to make sure there was precise dosing.
Yes, a regular drip was not used.
And there were no polypharmacy or multiple drugs were used, correct? It was just propofol.
Just propofol.
No other benzodiazepines.
Nope.
And in fact, this article, which was published in 2010, don't the authors of this article specifically state that further study still needs to be done?
Yes, sir.
In fact, on the last page of this article, they state, quote, future studies on the efficacy and safety of propofol-induced insomnia should be aimed at confirming these findings in a multi-center cohort study.
Yes, sir.
So the authors themselves acknowledge that it's only experimental at that time.
They say that specifically.
And it does not dictate an acceptable standard of care, correct?
No.
Correct?
I'm sorry. It does not dictate a standard of care.
Knowing that in 2010 this article was published and was characterized as experimental, isn't it in fact true what Dr. Murray was doing to Michael Jackson on June 25th, 2009 in the months preceding was essentially an experiment?
Yes.
Dr. Steinberg, I want you to assume in this question that, again,